Hello, everybody. Welcome to the Dr. Neil, the Real Deal Psychologist video. Trying to put these up on YouTube, TikTok, Facebook, Instagram, Twitter, wherever you can find me. I hope that they're helpful. I got a little bit of feedback from those of you who have watched them, and I've run into you at different places. So thank you for giving me the positive feedback. Keeps me wanting to keep doing this. But here I am again in my backyard on a beautiful day. The weather has cooled off, a little bit of sun, which means that this lifelong Arizona doesn't have to wear a jacket. So I'm in the sun, keeps me a little bit warm. Otherwise I would have a jacket on even in 60-degree weather. So, well, here we are in beautiful Arizona in the backyard, talking more about what to expect when we go to counseling. I think that's really important. A lot of people that come in to see me for the first time, whether they're a kid or whether they're an adult, really don't know what to expect. And so there's a lot of nervousness about that. Even if you do know what to expect, so someone like myself who has had almost 20 years of experience in the field, and then going to therapy myself still makes you nervous. So it's very normal to be nervous. I'm anxious about it, not a problem. But I think knowing a little bit about it might take the edge off, might give you a little bit less anxiety, a little more motivation to go. Like we talked about last time, the statistics show that about 1 in 5 people all across the United States probably struggle with something that's significant enough that a doctor would diagnose you with a mental health disorder or a mental health diagnosis. And that means you probably need to see a counselor. Probably need to see somebody to talk about, go see a psychiatrist, maybe about medication, group therapy, support groups, anything to try to help, because it's significant enough that we would actually notice that and diagnose it with something. Of those 20% of the people in the United States, less than half of them are actually getting help. So I think part of the difficulty is I don't know what to expect. I don't know what's going to happen. I'm going to go in, this person's going to do some voodoo type of thing, which voodoo might be really cool. I don't know. I haven't participated in it, but they might do something really unusual, something weird, pry into my mind, analyze me, understand my dark, deep secrets right before I even start talking. Not true. So let's get a little bit of the fear off and tell you about what the reality is. Counseling, most of the time, is you one-on-one with a therapist of some kind. And there's a wide variety of therapists out there, and with a wide variety of training. Everything from social workers, licensed professional counselors, maybe even a life coach, which really isn't therapy, but it's more kind of a help. But licensed professional counselors, social workers, counselors, substance abuse counselors, psychologists, which have a doctorate. Oh, there's the fire department testing out their things. And so a psychiatrist has a medical degree. They focus more on medication, do a little bit of therapy, but more on medication. Psychologists, we have a doctorate, but we don't have a medical doctorate. So we don't provide medication. We do more counseling, assessment, those kinds of things. So broad range of people out there providing services, psychiatric nurses, all kinds of things out there. But when you go, it's typically a one-on-one setting. You might have a partner that you bring with you to do couples counseling. You might come as a family to do family therapy. You might bring your child to do child therapy. But it's usually you and the therapist there. Really, in that first session, what they're going to try to do is do what we call an assessment. They're going to try to kind of figure out what's going on here. What brought you to counseling? What's the trouble? What's the challenge? And kind of help you decide what are some goals that we want to work on. So in that first session, they're going to ask you lots of questions about you. Hopefully get to understanding of what brought you there, what the concerns are, what the challenges are, what your symptoms might be in that particular situation, and then help you devise some goals. Where do we want to go? And then what that treatment might look like. So by the end, they should have an idea why you're there. You should have an idea of what might be some general goals that you're working on, a goal, maybe a couple goals, and you should have an idea of what interventions we might start trying. They might actually give you a couple of things to walk away with for the first session, maybe a little bit of homework. We can come back next time. These are the things to do. So it's really going to be about you. We're going to ask you lots of questions about you, what's going on with you in your life right now. Most of the time we focus on the here and the now. We might ask some questions a little bit about your background just to get some context, where you're from, what do you do for work, do you work, are you a student, just to give me some understanding of you and what your daily life is like, and how those affect your challenges. But we don't generally dive into your distant past. That might come later on if it's relevant. If it's not relevant, we don't go there. It's not everything is about your mom, contrary to what you might see on television. It could be about your mom, that's possible. So mom out there, I have talked about you in therapy, but generally positive. So we really focus on the here and the now, get an understanding what your challenges are, develop a goal, go in the direction. Most people come to therapy, what I think, for one of three basic reasons. One, somebody told you needed to go, and they've said you need to go for this reason. You've listened to them. You feel like it's important because of what they told you. Somebody told you to go. That's a lot of times with kids. They're there not because of their own choice, but because their parent brought them. Second reason is people have a specific goal in mind. You know what? I'm really struggling with anxiety. I'm having panic attacks. I can't do the social things I want to do. I don't have the friends I want to have. I'm struggling with relationships. I just broke up with somebody. Somebody died in my life, and I'm, dealing with the grief that's going on. So a very specific reason. Somebody told you, there's a very specific reason to be there. And then sometimes people come and they're not really sure why they're there. They just know that they're struggling and things are difficult, and they just want someone to talk to. And so any of those three reasons, perfectly good. But me as a therapist, try to understand where you're coming from. Oh, there's a specific reason. Let's focus. Let's help you achieve that goal. Somebody told you to be here. Well, let's kind of discover why you decided to agree with them and why you decided to come. And then how can we help you? And then that third reason, not really sure why you're here. You know what? Let's drill down. Let's talk. Let's kind of help you understand what the goals are, what the focuses are for you. So first session really is about you, getting to understand your context, developing some goals, and giving you some interventions. You should be able to walk away with kind of an idea of what's going on and where you're headed, and that's what good therapy is all about. So we'll keep going on in this little series here. I think I might do 3 or 4 more here over the next couple of weeks about what to expect when you go to counseling. If you have questions, please shoot me your questions on my socials, Instagram, Twitter, TikTok, Facebook. I'd love to incorporate those if you have any questions about counseling. And you can always use the for a friend question. I love answering those questions. So have a great day. Have a great weekend. It's beautiful outside. Enjoy it. And next time I'll catch you guys again. This is Dr. Neil, the Real Deal Psychologist. Be awesome by being you.